The other thing I'm concerned about is the forecasted cost of this thing. It's like over $100 million. And I'm just like, oh my gosh, how did it get that way? And so you page through the pages and pages and pages of the fiscal note, and you see these projections of how many people are going to come use this exchange, and they're projecting, 150,000 or this, way higher numbers than any state who's done it yet has bared out or borne out. And so there's no mechanism in the bill that says you don't have to hire to the top unless you're really servicing that amount. And so I'm concerned about the lack of scaling up based on demand in terms of the cost structure. So because of those things, I am using my opportunity as a legislator to influence the process. So that's where I'm at, and I'm talking to the chair, and whenever you're disagreeing with somebody who's carrying a bill, it's uncomfortable, and it's not easy, and I trust that somehow in this legislative process, we'll all work it out. So go ahead, Ben.
Well, I wish it was so nice as you described it, that the health insurance and the hospitals and the providers in Minnesota are so great. If it was so great, small business owners and individuals would be able to buy affordable health insurance.
Yes.
As a small business owner today, I'm paying as much as 20% of our income in health insurance.
Yep.
And I cannot afford to buy health insurance for my employees. So the system we have now is not so great.
Right.
Okay? Number two, the objective of the health exchange is to provide competitive health insurance rates.
Yep.
If the exchange is there and all we have is the same rates as today, the exchange will be worthless.
Right.
Now, some people want the exchange to be worthless because they're the same people that fought the affordable health care. So they can say, see, it's worthless, it doesn't do anything. So the question is, how do we achieve the objective of offering small business owners and individuals low health insurance rates? Can you address that?
Yeah, I think we do it by requiring, number one, exactly what we're looking for in benefit sets, and then by having the people in the marketplace are a purchasing pool, and we need to set the rates. We have to approve and set the rates. And so
Wait a minute, that's socialism. You just described socialism.
the board, no, I'm not.
Who's going to set the rates?
How many people?
Why don't we
It's,
just have
oh,
a
it
meeting
said
system?
today.
Yeah.
It said today, you go to United Healthcare, you need a procedure, this is how much money they'll
Right.
pay, and that's
Okay,
it.
you go.
You dive into the stuff and you understand, that's what you're saying.
I am concerned that, the estimates, if you look at the bill that's before you, the estimates that'll actually cause premiums to rise.
Terry,
Well,
Yes.
how many people in the room, just in this room, would need to use that system?
How many people in this room would use it?
I'm not sure by what you say
Yeah.
you need to use.
Well,
it.
people who get their insurance through their employer probably won't be going.
Right,
to.
yeah.
People who are on
I would not
Medicare probably
I
aren't
would
going
not
to
make
go.
that assumption.
Yeah, you can't
I am
guarantee
an
that.
employer, and last year we had a 30% premium increase.
Yep.
We paid 75% of the employee's health insurance. We had 25 people on the plan. We had one person with a significant medical condition that made the plan unaffordable for everybody else.
Right.
So the exact opposite happened. We were very willing to provide health insurance. One person made it unaffordable. Suddenly, 25 people no longer had health insurance. They tried to buy individual policies, ran into a number of roadblocks, and many of them went then without health insurance. We have tried to get the carriers then we had to wait 6 months to reapply to see if a carrier would take us. We've had 2 carriers come flat out and say, your group is not insurable. I don't think, I want to provide health insurance as a benefit as an employer. I don't think it should be required of me. And I don't think the percentage that I should pay should be required of me. I'm a good employer. I don't need to be penalized by the federal government because I don't provide health insurance. I'm willing to pay it. I'm willing to pay what I think is a reasonable share. but it is just simply not affordable. I can't afford to pay $90,000 for 25 people.
I hear you, and those are the stories I hear every day. So I'm just telling you that the hat I'm wearing is really also looking out for the overall consumer, because I am concerned that if we put forward an exchange that is too costly, it will end up being, I mean, it's a huge hole in the general fund. I mean, the cost has to be borne somewhere. On the other hand, I just want you to know, Ben, that I will do my very best to find ways to resolve these issues.
And if I offer health insurance, employees still can say, we can't afford that, and then they can have an option, as I understand it, to go into the exchange. And then again, as an employer, I believe there's a penalty or a fine for me for them not participating in the employer offered plan.
In Massachusetts, by the way, that had the exchange,
Yep.
the rates went down 20%, while at the same time, the national rates had gone up 13%. This is the individual rates.
Yep.
The family rates went down 40%.
And they only had 8,000 people participating. I know.
Yeah.
Yeah,
so
but we're
this
saying
idea-
150,000.
Yeah. Eventually, the exchange, they project, they will have 1 million people.
But they did the opposite, Ben. They're doing what I'm recommending. They staffed it slowly.
No, slowly is fine. But the idea is that, she has 25 employees. I have 4 employees. We cannot negotiate rates for 4 or
Right,
25
which is
people.
why the
But
benefit of an
if they
exchange.
give us, I testified at the Capitol, and what I said was, we're not expecting anything better than what big business gets. Big business that has 200 employees, they spend on average maybe $300-400 for health insurance, and we're spending over 1,000. This is totally unfair.
I hear ya. I hear ya.
Thank you.
I promise you, when I, go every day, I'm keeping in mind to the best of my ability all the people I represent. Okay. Thank you. Anybody else? You?
I've been studying it, but I'm just sitting back, kind of watching it,
Okay.
following up on it.
All
I
right.
believe though a lot of employers, because I'm weighing the same fact too.
Yes.
Is just paying the fine and saying that's it.
Yeah.
A lot of them, and by the way, I've employed up to 400. So I do believe that is going to happen.
Yeah. And we talked about that in committee today.
I do believe a lot of business owners I've talked to,
Yeah.
that's being considered very heavy.
Yeah. I hear ya.
Just to toss it to the side and say, that's it, go to the stage, purchase it.
Yeah.
That's the way I kind of view it.
I hear ya.
I think I'm still gonna offer it, but we'll see what happens.
Thank you.
Well, I think that's wonderful that
But
you have
just-
an opportunity to offer it. The carriers that are available in Minnesota won't even respond to our application.
So, and it sounds like if you have, sometimes people don't realize this, if you're on a particular issue and you contact our office, that sometimes a call makes a difference, I'll advocate on your behalf, and I'm happy to do that.
Thank you.
Okay, so.
But I agree with her too, and I remember, if I remember, history has it that an employer offered health insurance benefits to be a carrot to draw in employees because they weren't getting the employees, and that's how it started, but now it's stuck as an obligation.
Right.
I wish we could turn our view around to make it an individual responsibility and try to
Yeah.
make it affordable, that I can do it on my own, that I don't have to get a job with
I
a
agree.
company to get health insurance.
Yep.
It should be
And I think
individual.
that exchange actually has that potential for you as an individual to get it at the same price as though you were at 3M. And that's why I was first attracted to it, because I've long advocated that I think all insurance ultimately should be portable. And it shouldn't, if you look at the auto industry, one of the things people say is that the auto industry's decline was because we had to build in health insurance into the price of a car and we couldn't compete. And so you look at, all the various industries where that's true, where the Minnesota standard builds in all these costs and then we're no longer competitive in the global marketplace. And so I think portable, individual insurance has got to be where we go.
The employer should